of the size and the amount of tension on the wound. It can be because of the shape of the wound. It can just be because of where you're doing the suturing. So for example, in the emergency department, and you haven't got many options, and the patient's awake and they're a bit uncomfortable and it's all a bit chaotic, and you've got several things to do, lots of different wounds to close. The complexities don't make a difference. You need to have the skills and the options available so that you can do the suturing that's required. Let's start with the basics. As always, you need to be flexible. Thumb, ring finger inside the rings, middle fingers on the angle, index finger on the shaft of the needle holder. This is how you hold it in the mounted grip. As you get stressed, the most common thing I see is that the needle holder starts going down the fingers. You lose range of movement when you do that. So try and keep, even in times of stress, the needle holder in the pads of your fingers. You want to keep nice and flexible. When things are challenging and you have to get the range of movement in an opposite direction, such as in reverse, you want to be able to have the other grip, which is the reverse grip, the palmed grip. Make sure you have both options in your armamentarium. So complex wounds like this, we close them, you want to take off the tension. So let's do this, and then this. We're going to reduce the tension so we can put deep dermals either side with a dissolvable suture. So this is a temporary stitch. This won't hold, like you can see. So I can try one thing, which is a locking knot. Doesn't really hold. So then I go to my next option, take my index finger, go under. That's not good. Let me tighten it a bit more. Index finger, go under, hold the knot, go under my long suture, pull the tension back, and then suddenly my big gaping wound becomes easier to close because I've halved its size. That's tip number one. Tip number two, when you've got a stellate laceration, you can put one stitch here, and one in there, but that's a lot of suture for one small area. So here's another option. The corner stitch, the half buried suture. Starts like a horizontal mattress. The key to this, doing it quickly, is mounting your needle straight away. So I grabbed it with the forceps. I didn't grab the tip, I grabbed the body. You can see the tip over there. I'm not holding it, I'm holding the body. Mount it 2/3 along the distance. So another thing that I see, holding it too close to the swage or too close to the tip. Holding it too far down the needle holder like so, at the very edge, so you have the most rotation, the most flexibility. Pull your suture. Then the half buried then follows with an intradermal suture, an intradermal bite that just catches the corner in the dermal layer as if you were doing a subcuticular. Don't get caught in the loop. Turn the needle around. I've dropped it, so we'll just do it the other way, the way I like. Slick, right? And then do another intradermal suture on this corner. I'm going to pull it through in segments. I'm going to mount it straight away where I want it. And there's no extra faff of me holding it in the air, dropping the needle, doing all this, and then doing this, and then it not being correct. This just adds time. Mount it straight away like I did as soon as you pass the suture, and continue. And now I'm going to go into the palm grip so that I can do a reverse suture. So I've done interrupted, intradermal, intradermal, back to the other side of the interrupted, come out adjacent to where you started. And then we tie. 1, 2, I'm going around the tip, so I'm not doing this. It's not moving both my fingers and the needle holder. I just move the needle, just move my fingers. 1, 2 around the tip. It doesn't go down the shaft of the needle holder because then you get caught on this part. We don't want that, it wastes time. Just go 1, 2, grab the short end, the tip, not down here. If you grab it down here, it'll get caught in the knot. Grab it at the tip and pull till it closes. And then when you're happy with it, tie your next knot. So it's one suture technique to close 3 points. You can use a dissolvable suture, a non-dissolvable suture. And then the question we got asked was, what do you do for the rest? Whatever you want. So you can do horizontal mattress, that's what I'm going to do. It's always easier, another technique, to stitch towards yourself, and it's quicker than stitching backhand. So backhand for me is like this. I can do it quickly, but not as quickly as if I just go forehand. So forehand, 1, 2, I'm going to unlock the ratchet, push it through, grab it with the forceps, we're turning it around. You don't want to do maneuvers that waste time. You want everything to be slick and seamless. I've gone for a horizontal mattress because it should close the whole bit that's left there with one suture rather than having to put 3 interrupteds. Notice how my long and my short end are alternating. And then you can palm your scissors if you haven't got an assistant. So you're here, thumb, ring finger, turn it down. And then we'll do the others. Let's do interrupted. Haven't got my suture left. So there's not a surgeon that I think exists in this world that never put in the overtime. It might have been at home on a skin pad, it might have been on a course, but I can assure you, slip knot, tighten it again, I can assure you they put in the work in their own time. So if you're an aspiring surgeon, a junior surgeon, and you want a career in surgery, keep putting in the work. It will pay off eventually. You need to keep up with things like this. Go to free courses, go to paid courses, get some one-to-one mentorship. But keep progressing your skills, because that is the best way to become the best version of yourself. And if you want to be the surgeon you've always dreamed of, you won't get ahead if you don't invest in yourself. You can reap the rewards of that later. Notice I'm using my finger. Let the loop make itself. Let the loop make itself. And then the final technique I'm going to teach you is the locking mattress. So I'll zoom in a bit more. The locking mattress is a modification of the horizontal mattress. It's good for wounds under tension. This is the technique. It starts the same way a simple horizontal mattress does. Turn it around. So when I've come through, how I'm turning it around, it's in plenty of the other videos if you've had a look, but I'll show you again as if you've never seen it. So I've pulled it through, I've turned my hand over, I'm mounting it upside down, and then I go to the palmed grip, because then it's mounted straight away how I want it. And then I just go in next to it. So in this technique though, you push it through a bit more. Don't grab the tip like I said, grab the body. Don't let the loop go into the skin. Leave a loop, and then put the needle through the loop. Like so. 1, 2, and tighten. So it's a locking horizontal mattress. It's good for wounds under tension, because what it does, if I show you, where a wound would be under tension, this knot would go in, this loop would go into the skin. Risk, I guess, is skin necrosis. You lose the suture, can't find it. It spreads the tension more evenly on the top of the skin rather than it through the dermis. And in my opinion, it would reduce the risk of skin edge necrosis. I use it all the time when I've got wounds under tension, and I think it works really, really well in preventing that skin edge necrosis. Well, at least it does for me. My last 10 years. So we have covered how to hold our instruments. We've got our 2 grips, thumb, ring finger, middle finger on the angle, index finger on the shaft. That's the normal grip. The palm grip, or like this, but the fingers are not inside. We've talked about how to reverse our needle. Well, I've shown you anyway. Unlock the ratchet. That didn't work very smoothly, did it? So we've mounted it, we're here, pulled it through, turn it around, and we're there. And then the other way is when you come through the skin, take the body with the forceps, turn your hand over, mount it, and then palm it. And then you're good to go. We've talked about the half buried mattress. So you go in like a simple suture, go through the dermis, and then come out like a simple suture. And it tidies up all 3 points together as one. Talked about the locking mattress, where you do a horizontal mattress and go through the loop with the needle before you tie the knot. And then lastly, just an interrupted suture with some hand tying to take off tension on a gaping wound. So then now I could put in my deep dermals. Realistically, I'd probably put another one here and another one here so that I can put in deep dermals in between all of them. As I said, you don't get better if you don't practice. You do need to invest some time if you want to be a good surgeon, and it starts now. It starts with the skin pad and suturing. It starts with chicken thighs and a micro instruments and your loops or your phone as a microscope, doing nerve repairs and doing local flaps with a skin simulator that we're going to be doing next live on this platform. So stay involved, ask questions, post comments, stay subscribed, and let us know if there's anything else we can do for you. Have a good evening.